Right now, there are some signs of improvement. Canada has had more than 86,000 confirmed cases of COVID-19, and more than half of those people have now recovered. It's possible they could have some immunity to the virus. Jeff Semple explains.
I didn't leave my house for over a month, and I go out and the world's completely different now.
Kyla Lee is one of the recovered. Global National first spoke with the Vancouver lawyer in early April when she was in self-quarantine with COVID-19.
To be plagued with a fever for 2 weeks, a cough for over 2 weeks.
But today?
So how are you feeling now?
Great. Totally back to normal.
Albeit a new normal. Lee stepped outside to find a society gripped with anxiety, while knowing she likely doesn't need to worry.
But I am, I think, probably taking more risks than other people would as far as like when I'm out in public, just because I'm likely immune.
A made-in-Italy blood test, just approved by Health Canada, will be deployed in the coming weeks to help determine whether a patient has been infected and developed antibodies against COVID-19.
Now, so far, we don't think it's possible to get infected again.
And as economies reopen, some businesses are deploying new technology to separate the recovered from the rest. This smartphone software is one of a growing number of so-called immunity passports. The technology, already deployed in some European countries, is used to identify those who've tested positive for antibodies so they can go back to work.
Any and all tools that will help get life back to normal and save lives should be used.
Unsurprisingly, immunity passports are also sparking a slew of scientific and ethical concerns.
You could look at it as being an incentive for workers to deliberately infect themselves in order to get back to work.
And experts aren't sure whether the recovered will remain immune.
So we don't know what the expiry date should be on that passport. So the idea seems useful, it seems attractive, but without an expiry date, we just don't know how long that is a safe assumption.
But there is a growing push to deploy the proof of antibodies technology in certain situations, such as screening incoming international travelers and frontline care workers, where the need is greatest. Jeff Semple, Global News, Toronto.